Hello and welcome to yet another episode of Health Business. The tradition on this program is to give you health information that make you live a more healthier life. I'm your host, Oluwatoyin Kolaole. Sit back, relax, and enjoy the program.
Sickle cell disease is an incurable genetic disorder widespread in sub-Saharan Africa and among descendants of Africans worldwide. Sufferers have no visible symptoms but periodically experience severe pain and are also highly prone to anemia because the blood cells break down after only 10 to 20 days rather than the usual 4 months. From available statistics, 100,000 infants die from sickle cell disease in Nigeria annually, making it the #1 sickle cell endemic country in the continent. Based on World Health Organization indices, Nigeria accounts for 75% of infant sickle cell cases in Africa and almost 80% of infant deaths from the disease in the continent. A person can only inherit sickle cell disorder if both parents are carriers of the genetic trait, and then there's a 1 in 4 chance of giving birth to an affected child. Abayomi Ajayi is aged 52. She's living with sickle cell. She shares her story with Health Business.
I've been living with sickle cell for about 52 years now, and I wrote a book called Still Standing, chronicling my experience living with sickle cell and the challenges I went through. And through that, I realized that a lot of times we think we have issues, but people have worse issues than us. And it was in the book that I realized that sickle cell had not really been brought to the forefront, that there were a lot of issues that sickle cell has to deal with, people with sickle cell have to deal with. Since I have known how to manage my challenge, I know how I can help other people manage their challenge. It's been challenging. One of the first things I tell people with sickle cell is that it starts with the mind. Sickle cell is not the only chronic illness in the world, but because we feel, oh, woe is me, that's the only thing. There are a lot of people with all that. There's cancer, there's diabetes, there's so many, there's even more excruciating ones that people go through. But because it's us, we feel that, okay, that's the worst pain we've ever. Yes, it's really bad, but I always say it starts with the mind. If you have a positive mindset and a strong faith in God, it helps you to progress and understand your illness. Nobody can know your body better than you. You have to understand what triggers it. I know what triggers it. I know when I'm doing something, I say to him, you're about to get into Christ, so relax. I'm not drinking enough water. I know. I always know when I don't have to look at my urine to know. My body always tells me I'm not drinking enough water, or I'm not eating the right food, or I'm eating too much sugar, too much soft drinks. I know all those things. So it's very important that we know our body, and then get people who would support us emotionally and physically, because the truth of the matter is that we don't look for people who go, hey, yeah, sorry. Hey, yeah, sorry will not help you in any way, shape or form. But a lot of us people with sickle cell, we're looking for the hey, yeah, sorries, but that is not going to help you move on in life. You're just going to have that burden of, oh, I have a chronic illness and it's the end of my world. But no, you can achieve a lot. I've done so much, even at my age at 52. Although I started late because I was in that area sorry state. But in the space of from about 25, when I realized that this sickle cell disorder is not the end of the world, that's when I started to change my life, and a lot has happened to me since. So it can happen to anybody.
A medical doctor that specializes in the treatment of sickle cell shed more light on the management and prevention of this disorder.
Sickle cell is an inherited blood disorder that affects the red blood cells in the human body. So what happens is that people who have sickle cell disorder have their red blood cells living shorter than what it should be. So in the ideal person, it lives for about 120 days. But in patients with sickle cell, you have it living for about sometimes 20 days, and it's unable to carry out the required functions, which includes transporting of nutrients around the whole body and transporting of oxygen. So with all of these complications comes the different symptoms of sickle cell, which includes the pain, the crisis, the shortage of blood that we see in them. Person with sickle cell, first things first that they need to do, one, register in a dedicated sickle cell clinic. That clinic is not only when you are ill, even when the person is well. So they have a clinic they go for at least once every 3 months. Two, stay hydrated. You need to drink a lot of water, because one of the precipitants of crisis is dehydration. So by the time you have yourself taking about 3 liters of fluid every day, you find out that the person does very well. And three, take your routine medications, folic acid, anti-malaria, and the person is fine. These 3 basic simple things are my general advice to people living with sickle cell disorder that will keep them healthy and free from crisis. Wrong, it's not a death sentence. Nobody is God. Nobody can tell you when you will die. Currently in America, the average lifespan of a person with sickle cell is about 63. And the average lifespan of the average Nigerian who is not sickle cell, we know is less. So there is no certain age that, oh, this person will die at this certain age because he has sickle cell disease. We have people with it who are 92. There are people 52, people with children. So it's not true. So my advice to people with sickle cell, register in a sickle cell clinic, take a lot of fluids, take your routine medications, avoid anything that will tip you to having a crisis, and just stay healthy generally.
Coordinator of Genotype Foundation, a non-governmental organization that cares for indigent people with sickle cell, highlights the plight of people living with this disorder and what their team have been doing to help them.
Yes, it's to help those living with sickle cell and touch the lives of the younger ones, saving them from future occurrence of having sickle cell children by knowing their genotype. From statistics we got on our own as a coalition, I think we're having over 3 million people living with sickle cell, and 2 million living with SC. We have SS and SC. And because I think there's carelessness and not having confidence in themselves that, you know, they've given up right from when they were a child. There's this, they inculcate into them that you have a very short lifespan. So, and in them now, they're already defeated. So defeat also is something, and fear. So they live in fear. But we want to use this program to bring back courage into them, to make them realize that other people made it. You can also make it. Sickle cell is a genetic disorder. You can live with it as any other normal human being, and you can make it as any other. And as a matter of fact, when it comes to academic, nobody competes with them. By everyone knowing their genotype right from youth. If a parent have a child, the first thing you do is to make them know their genotype. When a child is a carrier, as an AS or AC, you begin to, you know, talk to that child that, look, sweetheart, you are a carrier, and it will be, you know, of your choice. We only cancel. It's your choice to make the decision, I want to marry. Even if you want to go ahead and marry an AS as an AS or AC as an AS, know the implications. And when you know the implications, it's on your table. So you select what you want, is your choice. So by the time you come out with a child living with sickle cell, you know what to do and how to take care of that child.
With early identification of newborn screening, initiation of penicillin, and routine immunizations, education of those involved in the child's care, specialized follow-up care, many of the complications of sickle cell disease can be prevented or managed promptly so that the affected children can lead healthy and productive lives.
A stem cell is a cell that can replicate itself or reproduce itself, and also has the potential to differentiate to other matured cells. And stem cells are cells that can either transform to maybe bone, cartilage, muscles, heart muscles, and stuff like that. They can differentiate into different type of cells. There are three major types. The first one, which is very popular because bad news travel faster than good news, is the embryonic stem cells, and that is when a potential human being, embryos at age of maybe 5 to 12 days, we call them blastocysts, is being taken, and then they are being grown in the lab to extract the cells from them. There's religious issue, it's controversial, and some other countries don't even allow it. So that's embryonic stem cells. The second type is induced pluripotent stem cells. That is when you take, for example, someone's skin, and then you take it to the lab, you reprogram it to behave like the embryonic stem cells, which both of them has the ability to continue to replicate, multiply themselves, continually. Because of that, there's a risk for teratoma, like a cancer or tumor. So they have not made it yet to the clinical stage for clinical use. So those first two are not really something you can get in your doctor's office. The third one has been proven to be safe, it's available. Many people are already using it in many countries, including even Nigeria here. It is called adult stem cell therapy. You are getting the stem cells from a fully matured human, and that also includes newly born baby. The word adult is not about age, it just means fully formed donor. Diabetic patients are one of those group of patients that have very well responded to adult stem cell therapy. And the way it works is the pancreas, it has islet cells that produce insulin. Now, there are two types of diabetics, type 1 and type 2. In type 1, which is mainly autoimmune disease, and it's also common in juvenile, in young people, the cells are destroyed. By the time the doctor diagnoses it, about 80% of those cells that produce insulin are gone. But the earlier you start treating it, the better and the faster the result. Type 2 is more common in people of age, maybe adults, especially those that are overweight or obese. That one, the body or the muscles is not even responding very well to insulins, and then the production could be normal but the effect is compromised, or there may be also less production of insulin. So for type 1, the orthodox way of treating it is giving insulin, mainly. Type 2, you start with medication to stimulate the production. Now, stem cell correct type 1 by repairing, regenerating those pancreatic tissues. So more cells, more islet cells are being made, which now produce more insulin, and slowly, gradually, the patient's insulin dose is reduced to the point of probably not needing it anymore. For type 2, the production is increased naturally because the pancreas also is being regenerated. Those ones respond faster, and then patients get totally off the medication, and all the complications that have been caused by diabetic all over the body is being repaired, regenerated by the same stem cell treatment. So even though the patient is getting just because of diabetics, it's also reversing the negative effect that has been caused by the disease.
Nice to know you are still watching Health Business this morning. Next on the lineup is the pharmacy segment.
In the month of November, pharmacists from all over the country and beyond gather in the chosen states for their annual national conference. This year, the chosen state is Abia State. From Monday 6th to Saturday 11th November 2017 at the Multipurpose International Conference Center, Umuahia. And the very apt theme of this year's conference is Medicines, Availability and National Security. The keynote address will be delivered by Dr. Andrew Nevin, Chief Economist, Price Waterhouse Coopers, an erudite scholar with vast experience in international business development and policy formulation. The conference theme will be discussed under three broad perspectives: regulatory, social, enterprise, and business. The conference promises to be a combination of learning, relaxation, business, and networking with various segments, including the star-studded opening ceremony, plenary sessions, exhibition, excursion, and poster presentations. The conference will showcase the rich culture of Abia State, including the War Museum, Azumiri Blue River, and the Ngodo Caves. The event will be capped off with colorful closing banquets. The PSN President Pharmacist Ahmed Kasai and Governor of Abia State, Dr. Okezie Ikpeazu, look forward to receiving you.
Historical accounts establish that the practice of preparing medicines and dispensing same, otherwise known as pharmacy, is the oldest profession in the world. Such accounts further claim that it is from this profession that other medical fields such as medicines, nursing, and lab sciences originated. In 1887, the European-style pharmacy was introduced in Nigeria, and this brought about the enactment of Drug and Poisons Ordinance of Lagos Colony in 1902. In 1923, the Association of Nigerian Dispensers was formed, and subsequently in 1923, the Poisons and Pharmacy Act was also enacted. In 1927, the School of Pharmacy in Yaba, Lagos was formed, and in 1930, the Pharmaceutical Society of Nigeria was formed. In 1956, it was recognized by the law as a professional society in Nigeria by the federal government. Since then, the Pharmaceutical Society of Nigeria organizes a national conference every year to address the achievements and challenges of the association and profession in the country. So, what form is this year's conference going to take? The Central Planning Committee Chairman, Lulu Ujo, let us in on the plans for this year's event.
For us as pharmacists, whether you are in the hospital, you are in the community, you are in the academia, or you are in the industry, we want everybody to be conscious of what their roles are in making drugs available, particularly to those communities that may not be as privileged as those who live in the urban cities.
What is this year's conference tends to achieve?
We are doing something to reach out to unserved community apart from medicine availability. And one of the big features of this conference is that we are going to be impacting a community not far away from the capital who has never seen an organized medical facility. So we take the medical facility to them by using a mobile clinic and making sure that everybody involved in the healthcare system is there. The doctors, the nurses, the laboratory, the pharmacists, and we take their drugs there. And we hope that we'll be able to serve about 500 people so that their immediate need, can be taken care of.
How will the public benefit from the outcome of this conference?
We will have medicines available as needed at the time that is needed. That's one. Two, the upsurge or the increased tempo of activity in local growth program will mean that more people will be employed. So it will create more employment for people. Then again, if we are able to rationalize or sanitize distribution of drugs, then our people can buy their drugs with some measure of confidence that they are buying the right thing. And we will remain healthy.
All roads lead to Umuahia, the capital of Abia State, for the 90th Annual National Conference of the Pharmaceutical Society of Nigeria.
In the month of November, pharmacists from all over the country and beyond gather in the chosen states for their annual national conference. This year, the chosen state is Abia State. From Monday 6th to Saturday 11th November 2017 at the Multipurpose International Conference Center, Umuahia. And the very apt theme of this year's conference is Medicines, Availability and National Security. The keynote address will be delivered by Dr. Andrew Nevin, Chief Economist, Price Waterhouse Coopers, an erudite scholar with vast experience in international business development and policy formulation. The conference theme will be discussed under three broad perspectives: regulatory, social enterprise, and business. The conference promises to be a combination of learning, relaxation, business, and networking with various segments, including the star-studded opening ceremony, plenary sessions, exhibition, excursion, and poster presentations. The conference will showcase the rich culture of Abia State, including the War Museum, Azumiri Blue River, and the Ngodo Caves. The event will be capped off with colorful closing banquets. The PSN President Pharmacist Ahmed Kasai and Governor of Abia State, Dr. Okezie Ikpeazu, look forward to receiving you.
Welcome back on Health Business. Many men still blame their wives for their childlessness because most of them do not know that infertility is a two-way thing. Let's join Dr. Abayomi Ajayi for more information on male infertility.
Oh, hello. Welcome to Understanding Infertility with Dr. Abayomi Ajayi. And today we're going to be discussing something very interesting, male infertility. This is responsible for about 50% of the time for why a couple is unable to achieve pregnancy. Male infertility can be defined as a situation in which a man is unable to make a fertile woman achieve pregnancy. It's usually unsuspected because there is no symptom. Now, what are the causes of male infertility, you may ask me? The causes of low numbers will be that it's genetic, that is being inherited, or there is undescended testes, a situation where a man, the testes are, it's said that they are supposed to be in such a condition where they can always get fresh air. Sometimes you can look at some people's scrotum and you cannot see a testis, or sometimes one is missing, or sometimes the two. Also, infection can cause low number of sperm counts. And then there is something called torsion, which usually is a result of either an accident or injury. And the thing that we call the worm of the testes, which we call varicocele. And sometimes you're producing good number, but the function is just not good enough. Then other things are like lifestyle, drugs, alcohol, smoking, they tend to reduce sperm count. Obesity reduces sperm count. And excessive exercise can also do that. Or sometimes there is hormonal imbalance, which causes the testes not to be working well. And in some very few people also, they're said to have sperm antibodies. Now, how do we make a diagnosis whether a man has male factor infertility? That's where the catch is, because most of the time there is, like we said earlier on, there are no symptoms. And unless you do a test where the sperm is actually examined under the microscope, it's impossible for you to make a diagnosis. So you need to do the test, and that is done in laboratories. So here we look at the count, we look at the density, we look at the ability to move of the sperm, we look at the abnormal forms, we look at the percentage of abnormal forms, and then we look at the number of white cells that are positive there. And then the World Health Organization has given us some guidelines on how to see whether they are normal or abnormal. The interesting thing is that what we have regarded as normal has continued to decrease over the years, because it's obvious that sperm count is decreasing with time. Then the next thing is, how can we treat when the sperm parameters are not at par? We can look at this from 3 different views: drugs, surgery, and assisted conception. I think that's where we're going to round up today. We'll see you next time. Remember, together we can conquer infertility. My name is still Dr. Abayomi Ajayi. Catch you.
I'm sure you must have enjoyed today's episode. Well, join us next week for a fresh package. My name is Oluwatoyin Kolaole. Remember, living healthy is a serious business. Bye for now.